Well, good afternoon, and my name is Yvonne Lewis, co-director of the Healthy Flint Research Coordinating Center, and I'll be your moderator today. I'd like to welcome you to the 72nd edition of the Flint Community Webinar on Coronavirus. This webinar is brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. We're so excited to be able to come to you and share, and hopefully you will take the opportunity to share with us as well. The Healthy Flint Research Coordinating Center is a multi-institutional partnership with community partners and academic partners from our three major academic campuses here in the state of Michigan. We have Michigan State University, the University of Michigan, Flint, and Ann Arbor. They have co-directors that assist us in getting this work done. And our goal is to bring information to you that's vital with credible messengers from our community. We want to thank you for joining us today, and we will encourage you, especially for those of you that join us weekly. You know, we ask you to put those questions in the Q&A because we have a great panel that'll be able to answer these questions for you. We are streaming live on YouTube and Facebook. So if you have some friends and family members, send them that link and ask them to join us and be a part of this conversation today. We appreciate your feedback. So again, we're going to ask you to put your questions in the Q&A. If you're joining us by Facebook or YouTube, you can go to info@hfrcc.org and add your questions there or your comments. If you want to give us a call at 810-835-2130, we'd be happy to have your questions entered from that perspective and be sure that we can answer those for you. We have a wonderful team of panelists today. I just want to highlight a couple of them because over these last few weeks, even though we have focused on the coronavirus as a result of the pandemic of COVID-19, we have addressed a myriad of issues that face our community. So we have representation from Hurley Medical Center. Of course, we continue to have representation from the City of Flint. The Greater Flint Health Coalition has representation here to answer questions for you. We also have representation from the Genesee health system, which last week gave us a wonderful exercise to deal with our mental health, and from the Genesee Health Plan, also here to answer questions for you. So please put those questions in the queue and let us help answer those questions. Your questions will also give us insights for future issues we may need to address through the webinar. Today, we have a very exciting conversation that you'll hear today. We're going to talk about rapid response to support vaccine efforts in our community. We'll hear updates from the City of Flint, as well as what the Genesee County has to say. Our health department is going to share with us about this COVID status in our county during this time. Our goal again is to bring you credible information. So we ask you to just get your pencil and piece of paper out, because there will be some things I think today you want to make sure that you jot down. We have three special panelists that are going to share with us today. I'm going to introduce them, and then we're going to have a little chat about what's coming up in the next few weeks. It's going to be really exciting. I'm happy to have with us today representatives from the Community Foundation of Greater Flint. We have Sue Peters, who's the Vice President of Community Impact at the Community Foundation of Greater Flint. And we also have Moses Bingham. Moses is Director of Special Projects and Initiatives at the Community Foundation of Greater Flint. We will also be joined by Jamie Gaskin. Jamie Gaskin is the Chief Executive Officer of United Way of Genesee County. And he has been very instrumental in many, many ways that sometimes people have no idea about, because he's a little quiet behind the scenes for us. And so today I'm going to ask these young people, I call them young people because I think they're all a little bit younger than I am. I ask the young people to come and share with us. They're going to open up their cameras now so we can see them all, and they'll join me in what we call our Hollywood squares here today. So we'll ask all of our other panelists, please turn your cameras off, and we'll just highlight these three individuals today. So welcome Sue, welcome Jamie, and welcome Moses.
Hello. Thank you for having us.
Hello, yes, thanks for having us.
Now
look at that picture you got. I got a lot more
I
white
know.
than I would see.
Same here. Those pictures are nice. They do make us look like young people. So thank you.
we try to put our best foot forward, right? Well, we know that over this last year, COVID has been just a tremendous challenge for all of us. But I know the Greater Flint, the Community Foundation of Greater Flint, and the United Way have worked so closely together to make sure that resources are available for our communities. I just want to give you some space today to talk about the most recent activities that you've done and any other insights you want to share with our community.
So maybe we should just say a few words about the fund that we've created, some of the contributions, and maybe what's remaining, and maybe some of the projects. The United Way and the Community Foundation came together to create the Flint Urgent Relief Fund, really based on the joint work we had done around the water crisis. Each of our organizations has contributed money into the fund, as well as we've attracted both government and other funders. So, for example, the United Way's contribution, we made a $1.2 million unrestricted contribution to the fund. The C.S. Mott Foundation made 2 contributions totaling $1 million to the fund. There are some other chunky donations, like I think $50,000 a few different times from the Ruth Mott Foundation. And then we had some federal contributions. We were able to leverage some of the relief funds, I think about $1 million, 1.2 million, something in there, as well as dozens of corporate supporters that either contributed to the United Way first, and then the money was put in the fund, or contributed to the Community Foundation, right? So we've taken all those resources together, and we have about a 9-person review panel, and we allocate those dollars on a weekly basis as applications come in. Most recently, we did receive another $134,000 through United Way and the Michigan Association of United Ways with some state COVID relief dollars. And we also allocated all those dollars in what we would call mini grants, up to $10,000 for COVID relief, what we call grassroots vaccine hesitancy reduction. And I think we funded 17 projects in that bucket, and those projects are actually getting their orientations tomorrow, and they will start rolling out in the community over the next 2 months. So I'll kind of leave it at that, and I think maybe Sue and Moses can talk about some of the specific work. It's the biggest thing is that it's working together to maximize leveraging funds both from local, regional, national supporters, and then really maximizing the investment of those funds in the community.
Right, and thanks. I'll jump in now, if you don't mind, Jamie, just to add a little bit more, right? For us, and again, my name is Sue Peters, and I'm the Vice President of Community Impact at the Community Foundation of Greater Flint. I actually joined the Community Foundation right during the thick of the water crisis, when the foundation at the time was trying to stand up the Flint Kids Fund and try to write to all these grants that were coming in. So trying to really get the money in the door, but then also out the door. And it's exactly during that time that we did realize that the United Way was an invaluable partner for us. And we I think hashed out at that time, kind of figured out what our roles were in that space. So Jamie was very much, immediate relief. We took that longer term stance of looking for the Flint Kids Fund was a 20-year fund, looking at following the impacts of children and families over that 20-year span, right? Because we didn't know exactly how it was going to play out. But then during this crisis, I think this is how things usually work. Isaiah's on a plane. Isaiah's our CEO. He has this idea. So he texts Jamie, and then and they agreed within, I think, that text message to say, yes, let's stand up this COVID relief fund. Within, I think, 2 weeks, it was done with our first $1 million gifts. It was something like that, right, Jamie? And it was just amazing, right? So in this case, we did really rely on our experience in the water crisis to stand this fund up very quickly. We, in this case, knew our role. Even if you look on how we frame and talk about this fund, it was established in partnership with the United Way of Genesee County. And we really believe that we continue to partner now in establishing the strategies. The goal was really to support those nonprofits that were providing services to the most vulnerable during the crisis. We were meeting weekly at the time. The goal was to get answers out with intent. So really quick, rapid response. And just to fine tune Jamie's numbers, he was right on. I can give you exact numbers just because that's how I am. But just to let you know that in total, 3.9 million was raised. We have all of that out the door, except about 900,000 or so. We have made a total of, we received 258 proposals. And we started in about April of last year. The requested amount was 7.5 million. We've approved up to 2.2 million. That's 150 different rewards of 98 different institutions. So just to give you a sense of the breadth of what we saw during that time, we're not done. We're still here trying to manage and navigate this ever-evolving crisis. And then just to say that then when there are opportunities that come through, we can use this structure. And I think we envision using this structure if we have, God forbid, future crises. But Jamie had this amazing opportunity from MDHS, right? And they turned to the United Ways and said, how do we get grassroots groups, grassroots groups, say that 10 times fast on a Friday. How do you work with them to really get out the message? They're the ones that have the trust. They know how to connect with the neighbors. And we were just off of a partnership. We did the very same thing with the census, right? Where we had funded 30 groups, small grants to really work, knowing that they had the trust with residents to have the conversation about why it was important to do the census. So Jamie and I were like, this is a no-brainer. We'll run it through GFIRF. We'll do like we did with the census. And so yes, we funded 17 organizations, and they have their orientation. Some of them are some of our census grantees, some new ones. So we're just really excited about the creativity that the nonprofits have for their activities that they plan. So I'll stop there though for now.
Indeed, and just on the heels of that, I will echo the same sentiments as Jamie, and to Jamie said something very important, that we're trying to maximize and leverage dollars or buckets to get dollars out into the community in a rapid response manner. And so, we at the Community Foundation, there's no bucket left behind. And so we're going to go out for each as many dollars as we can. And so what happened and transpired, on the heels of the Greater Urgent Relief Fund being formed, we went out for federal dollars. And, nationally, federal dollars is something foreign to the Community Foundation, but we took that chance, we took that risk and said, hey, how can we, maximize and leverage dollars? And so there was monies that were facilitated by the NPHI. And, those dollars were applied for it in March. And we didn't actually receive them in October, and we had to execute it by the end of December. And so, we have this task force, which many of who are on this call today are a part of, and it's the task force on coronavirus racial inequities. And so, even with all the things that are going on, coronavirus exacerbated, the matters as facing minorities and people of color. And so, with this task force, we went through, I want to say, almost over 150 applications in a very short matter of time. I'm talking about less than 24 hours. And so to get to whittle that down and to get $2.5 million out into the community with various projects, those who are providing resources for those who are facing evictions, and those who are facing food insecurity, and those who are facing other issues in terms of health access, education, and advocacy, is something that we've really pushed forward in making sure that dollars can get out into the community to the people who are doing the work. And so rapid response has been, the name of the game in terms of this COVID-19 pandemic.
Thank you. Now, you raise an issue when you talked about two things that I think are important to kind of pull out a little bit. You talked about equity. You also talked about the need to work together, and you found your niche, but you blended them. Can you tell us about how you work that out?
Well, yeah, Jamie, why don't you start maybe?
Sure. Well, I think during this same time, we also, as a partnership, have gone through a little bit of a journey about learning, together. We brought together both the full United Way staff as well as the Community Foundation staff, and did a full 2-day groundwater training, sort of racial equity, history, implicit bias training. And we did that together, and we've been on a journey together with these various, I guess I would call task forces and subcommittees related to racial equity. And I think, I kind of look back at my 20 years here in the Flint area. I can tell you truthfully, probably the last year and a half, almost every day, we're having conversations that involve the, equity. quite frankly. And I could tell you, going back before that, I can't remember that ever being such taking up that much of our, really our space and capacity to consider how that is impacting everything else we do. So as organizations, we now have really distinct outward facing statements on our website about racism and equity. And we have a strategic plan as a United Way about how we're going to invest and think about it and evaluate that in our regular grant making process. So I think we've all been through this other journey that's kind of parallel with COVID that quite frankly has to do with a lot of other issues as well, right? That have been able to be lifted during this time. So we are thinking, like in our grant applications, that's a question. How is your programming addressing, race and racial equity and so forth? And that's an evaluation area for us to consider when we're deciding where we're going to invest dollars. And I think we're also very interested in organizations that are led by what I would broadly describe as people of color, or people that represent communities that are really underrepresented in leadership and influence, right? And I think we're especially trying to understand how those organizations work, and sometimes how those organizational leaders are maybe in a different place and are processing their leadership in a different way than what might be more of a typical standard that we might be used to, maybe with a large historically, institution that's been really, quite frankly, probably led only by white, probably mostly male leaders. So there's lots of parts of this, but I think the first part is we've all committed to the learning journey about this. And I think we've all said, we certainly, none of us know enough, and we're going to learn together. And then we're going to talk about equity in all the work we do, right? That's always going to be a part of the conversation. And that's how we begin to make better decisions and choices.
Yeah, go ahead. I was just going to add from our perspective, I think we realized, and right along with Jimmy, like during the water crisis, we needed to work together differently or things weren't going to change. At the same time, we had received a Kellogg grant, a national Kellogg grant for what was known as Truth, Racial Healing, and Transformation. And that was on the heels of the water crisis, in that they knew we were challenged with the water crisis problem. There's systemic racism at play during the water crisis, and that if we didn't acknowledge that and or try to operate differently, it wouldn't change, and we might have another one, or we might not be ready for the COVID pandemic. And so Jamie's right. We also went on a very intentional equity journey. I kind of forgot that we're doing that together. We have been doing that together since the water crisis, and we too now in our strategic plan, it is front and center. We call centering equity. So from our business model, anything from development to our investments to how we grant make and do community leadership is based in equity. I think for us, though, it's become formalized, or we've been able to have these conversations because of the task force. There's the subcommittee for philanthropy. And so we are having conversations that in my 20 years too, as well in the community, I haven't heard us have as funders. So I'm hopeful, and I hope I'm heartened probably more than ever that this will continue to be in our work. So it's been really great. And I do think I'm really enjoying how we've been working together. And I feel a commitment and energy in Flint that I hope continues. So.
Yeah, that's highly important. As Jamie and both Sue has said, the level of intentionality is vitally important to what we do. There's an idiomatic expression that says, show me a man's checkbook and I'll show you his values. Our values had to shift. Our dollars also had to shift as well in terms of that level of being intentional to make true impact, because anyone can talk and sit in the committee or a task force, but where are those things of actions? And when you talk about, working across, organizations or working collaboratively, even with that rapid response initiative, we work with the chamber, we work with Metro to help get dollars out to, small and minority businesses. And so it just makes sense as a community foundation organization that speaks to the community, we have to talk about being reflective of the community. And you talk about the United Way, we have to be united in everything that we do to make sure that we're making intentional measures of change. And so I'm really excited about that.
Moses, can you just talk about how you're proactive in the relationships with the grantees and exploring how they can better execute, right? Because we don't always get proposals that fit, but there's these extra steps that are being taken to work with organizations and to explore opportunities for how we invest. We're not just waiting for proposals to come in.
Yes, indeed. I mean, we have to be out in community and, fill the gaps and feel the needs. It is kind of ironic, Sue and I, we were on a press conference assignment on Tuesday, but we took the time to stop by some other organizations just to say hi. What's going on? What are you doing? Right now in this next quarter that that we may need to pay attention to. Who are you partnering with? And having those really drilled down conversations and being intentional in the way that we are a part of the community. One person once told me before, we want to do things with the community, not to the community. And so it's vitally important for us to be boots on the ground and very connected with the community and be proactive, as Jamie said, as we look at grant making.
And I think it's very much a work in progress for us, but we have some good ideas. We have based on our strategic plan and the framework we've laid out, but Moses and I have been talking about things like maybe we don't even ask for an application. Maybe we set aside some dollars to make it very easily accessible. We're also looking and digging through our grant database and our data. Who have we been funding? I mean, what does our checkbook really say, right? I mean, we kind of know, but do we really know to make it data informed? And then also through the philanthropic subcommittee, we're talking about finding new ways to think about providing technical assistance to Black-led, Black-serving organizations and to increase that leadership pipeline. So stay tuned. There's a lot more to come, and I'm just excited to be working with great partners so where we can bounce the ideas off of and figure out what really will be impactful and important and work, right? And work for the community.
Well, we thank you all. I'm going to ask you a couple more questions, but I just want to say we thank you all for coming today. And I was told that it wouldn't be a problem to get you all to talk, so I could just sit back and listen. Yeah. Already we've gotten great responses from some of our participants in the webinar. I think it's so important for our community members to actually hear you as community leaders, be able to return. Yes, we need to deal with the issues straight up. Can we say Black? Can we say white? Can we say Indian? Can we say we don't look like what we need to look like? This makes a difference in how now our community is the intention that's being put forth by the partnership to make sure that our community has the resources necessary to make the difference every day. Because health is all of this. It's coronavirus, yes, we've really been focused on that. But it is when we live, eat, work. Equity. All of these things are so important. So we thank you for that. Now, if you can you give us some insights on the exciting activities that are going to be coming up in the next? Just a little insight.
So you want us to talk about what we were really supposed to talk about. So Jamie, do you want to start, since you brought the money to the table?
We talked about
sure. I would just say, and again, Sue's team is going to have some really good insights. I think we just released, $134,000 worth of grants to the smaller organizations that are in this, like what I would describe as this final push. I don't know how long it's going to have to last, to engage people around vaccine hesitancy in very creative ways, right? So we're talking about, neighborhood festivals. We're talking about door-to-door work. We're talking about feeding people and having a vaccine clinic on site. About creative partnerships where, we're feeding people without the expectation that they're going to maybe have the shot, but we're going to be able to have conversations with them, with peers, and hopefully by the end of that time, we're going to work on that hesitancy, and we're going to get 5 shots, 10 shots, 15 shots. We don't expect to get hundreds of them at a time, but every time we get a dozen more people, that do this, that's a dozen more people that maybe we're not worried about if they get sick, losing their lives. And we've just lost so many lives. I mean, some people maybe don't feel it directly, from outside, maybe our the core of our city in some ways, but we've lost so many close people to our the people that work for us, our family members. And so we feel it really acutely that even getting one more shot, is protecting one more person. So I think maybe Moses or Sue would talk about some specific ones. There were a couple that were kind of off the wall that, we weren't really expecting, but we want people to engage people in ways that we haven't already done it.
Yeah, it's for sure, Jamie. I mean, that level of creativity, rings true. We have to build on what we know. For example, someone on this call used to do a thing called Be Wise, Immunize, and so, we know that engagement, works. And so, in being creative in the engagement, our message has to be continuously the same, but our methods have to evolve and adapt to the needs of the community with the level of hesitancy that there is in this community. We need trusted individuals who are in the neighborhoods and live in those neighborhoods and, and talk and work in those neighborhoods to go door to door and have access, have education, and have it available in terms of having the vaccine right there, because when you make up your mind, you need to have it right then and there. And so that's really the beauty of this thing, is making sure that access has been available with great partners, Hamilton Health Clinic, Genesee Health Systems, the health department. Everyone is all hands on deck to make sure that, these small but mighty organizations have access to make sure that the vaccine is available right then and there. And so something, some people are doing things like food giveaways and those carnival things. I think there's something this weekend, even at what is it, Salem Lutheran, they have a neighborhood block party. And so these things are very important to, the life of the community as we're still in the midst of this pandemic. But, the messaging may say that we're out of it and people without masks, but we still are seeing the disparities in those under 45 that are not getting the shot. And then there's a new Delta variant. So, education and advocacy is the name of the game with this piece.
Yeah, and I can walk you through some of the examples. And as Jamie already talked about, but just as a reminder, almost 20 organizations, 17 grants made, totaling $134,000. The idea would they be smaller grants, so up to $10,000, really meant for organizations to do grassroots outreach. And again, it was based on what we knew. We just know that those are the folks that have the trust with our residents and can have the best conversation and try to either answer questions or challenge the dominant narrative around vaccinations and adjust, because as we know now, those messages have changed. We even tried as GFRF, right? We did a campaign. Well, that's not going to be. We know that's not enough anymore. So we've been trying to adjust our interventions and counting on our nonprofits to do that as well. And if I could just underscore the importance again of having the partnership and the structure of GFRF in place, we were able to get the RFP out. We ran it right through that same committee to make the decisions. They've been so committed. They met an extra time during the week. They've been more than generous with their time and made decisions so we could get the money right out the door, because this was a short time turnaround as well.
I would only, so if I can just jump in, I would just say the one thing that's been good is it's been nimble in that as the needs have changed, our allocations into those immediate needs have changed. So early on, we were buying masks and sewing them and, delivering them to Flint public housing and doing a lot of food. We've really transitioned that into this vaccine hesitancy space. So we're no longer necessarily funding the shelter of Flint and all the shelters because of the capacity issues when they had to cut their capacity in half. But we've transitioned to this other space, and being able to, with a community group, pivot around as the crisis develops and continue to have resources to allocate is a big deal. We really tried to focus on what are immediate needs because everybody wants money, right? We get all kinds of applications asking for endless kinds of projects that are all wonderful, but we really, the purpose of the fund is around the immediate need. So what do we need for the next 30, 60, or 90 days? Please don't ask us to fund you for a year. We're focused on like now, not beyond that 3-month window.
So let me give you some of our favorites, right? Or I should say my favorites. I love to give our grantees a shout out, but, and you heard some from Moses already, but for example, Ballinger 3 Together, it's a coalition of 3 neighborhoods, right? And the fiduciary is McCree Theater. So maybe not your usual suspects, but they have, we funded them to really do some canvassing, some surveys, and then some giveaways, right? So Communication Access Center for the Deaf and Hard of Hearing, making sure that our folks who are hard of hearing have this information in a way that works for them so that they're not left out of that information loop, which is kind of a piece we learned during the water crisis, but it informed us. North Flint Neighborhood Action Council, really looking for vaccination safety, vaccination outreach at events, just a couple, El Ballet Folklorico, right? Making sure, they can build it into even some of their events that they have, and that we know that it'll be available in Spanish. R.L. Jones, Mother Jones, if anyone can convince anyone of anything, she can, right? So Mother Jones actually already had a partnership with, I love her, she keeps me on my toes, but she already had a partnership with Kroger. And so, and you know what? She walks car to car and says, are you wearing your mask today? And let me tell you, I mean, she has one-on-one conversations with residents and they trust her. So gosh, let's get her doing that. And Genesee Free Medical Clinic, just to give you a sense, Mott Community College, International Center of Greater Flint, Michigan United, who are our public health navigators, Harris Memorial Church, not to give a shout out at them. I happen to know the pastor there, the new senior pastor there is starting to do giveaways. Right, Moses? So they've started to do giveaways, and it's just really the connections in our neighborhoods that, and all of the folks on the ground that we're hoping can help us get over the vaccination hesitancy. So.
Thank you all so much. I know we could probably spend the next half hour because there are more questions that I have, just out a little deeper, but we want to thank you for the insight that you've given and really showing that this partnership between United Way and the Community Foundation of Greater Flint is moving dollars to where people can get them and they get to our community members. We can't force anybody to get a vaccine, but certainly we can make it accessible and help encourage them when they need it. So again, thank you to this great team. If I were in church, I'd say everybody give them a hand because they were great. But it leads us now to understand.
Yvonne, can I just make one quick shout out? So we funded all these grantees who will be having events. So keep an eye on both of our social media pages because we plan to push out the events that are going to be funded through those grants, just so that you can send folks and or participate, you know what's going on. If we get a calendar or a list of events, we can share that as well. But for the very least, look at the social media because we'll be pushing out events going on downtown in our neighborhoods so that you also can spread the word. That's it.
So
Thank you.
On this call today, this webinar today, please make sure you share this information with others and they can go back and look at the YouTube even and get the details. So we're going to talk to the health department right now to find out what the health department's update is with respect to COVID numbers in our community and opportunities for vaccines and testing. Darrell.
Good afternoon, everyone. Can you hear me?
Yes.
Alrighty, great. So we are continuing our efforts here at the health department to vaccinate the community. As you can see on the screen, about 325,000 plus doses have been administered throughout Genesee County, and we continue those efforts on a day-to-day basis. Looks like 44.3% of our population has completed the full series of vaccinations or the 1 dose. Next slide, please. I do want to inform everyone that our COVID-19 cases are increasing weekly. We've seen a 39% increase in the number of COVID-19 cases. Last week, we had a positivity rate of 3%. It is now at 6.9%. So that is kind of unfortunate considering that we had got it down really low, almost to zero. So it's important that we continue to reach out, educate, and make sure that our neighbors, our friends and family are getting vaccinated to prevent the spread of COVID within our community. And the Delta variant is most prominently circulating in the state of Michigan right now. So we just have to make sure that we're social distancing, wearing our masks, and getting those vaccinations. And there is a perk to it. Until August 3rd, you can enter My Shot to Win the lottery. So if you haven't been vaccinated, we encourage you to get your vaccine, and you can visit our website for more information on that. Next slide, please. So we do have a few upcoming clinics with times on the screen. Today, we're going to be at Miller Road, McDonald's. That's at 3060 Miller Road. We'll be there until 2 p.m. where you can receive your Pfizer or J&J vaccination. If you got your first dose from somewhere else, you're welcome to come there and get your second dose. We just want to make sure that we get everyone vaccinated who wants to be vaccinated and that you complete your vaccination series. Tomorrow, Fleming Road Block Club is having a block party. We'll be there administering vaccines from 1 to 3. We'll also provide Pfizer and J&J. Tuesday, we'll be at Our Lady of Guadalupe Church, which is a standing clinic every Tuesday. That's from 12 to 2 p.m. Next Tuesday, we'll be doing Moderna and Pfizer. And we'll also be at Agape Church, located on Wyoming Street from 10 to 2 p.m. on that same day. And we'll have Pfizer and Johnson & Johnson available. Wednesday, we'll be at Central Church of Nazarene from 10 to 12. Thursday, Shiloh Missionary Baptist Church. That one is a little later in the evening. So if you can't make it to an earlier clinic, we'll be at Shiloh on Thursday from 3 to 6 p.m. We will have Pfizer and Moderna. And then Friday, we'll host an event at the University of Michigan Riverbank Park from 2 to 7 p.m. So we're hoping that we can get everyone to come out, bring the children who are 12 and up to receive their vaccine. School is getting ready to start again. So we want to keep our kids safe and keep them in school this year, and also see those positivity rates go down. And Saturday, if you're in a neighborhood at Sharp Manor neighborhood, there'll be a block party, and we'll be there from 1 to 3 providing vaccine to our community, Pfizer and Johnson & Johnson. Next page. And if you know anyone who is homebound, who needs services, you can give us a call or register online. That phone number is going to be 810-344-4800. And in the meantime, we encourage you to get tested if you've been around anyone who may have had COVID, and just to be safe. Sometimes you won't have symptoms and you can spread it. So visit some of the sites listed on the screen to receive a COVID test. You can go to Word of Life Church, Bethel United Methodist Church, or Macedonia Baptist Church. And we also are doing testing at Hamilton Community Health Network, Genesee Community Health Center, or you can visit your local Rite Aid or Walgreens. Next slide, please. All right, and we are at the end of updates. Like I said, you can visit our website, gchd.us, or give us a call at 344-4800 if you have any questions or you need to find out where's the nearest clinic, or if you have someone who is homebound and needs to get their vaccination done at their residence.
Thank you so much, Sherelle. We do know, as you can see, that there's so many opportunities that are expanding or right in the neighborhood. So we're going to encourage you, if you know someone, even if you have questions, there's a great event that happened last Saturday as well, and people just had questions. So if you go to the events and you're not sure, just go in and ask a question. Someone will be there to really be happy to answer your questions. So again, thank you, Sherelle. We want to get some updates now from Mary Catherine, who is responsible for the policy brief for the Flint Center for Health Equity Solutions. So welcome, Mary Catherine.
Thanks, Yvonne. Always good to be here with you guys on Fridays. So if you have any questions, feel free to shoot me an email at crawf457@msu.edu. And if you have any questions about the data, please feel free to message my dear colleague Rick Sadler at sadlerr@msu.edu. So let's dive right into the rising cases here in the county. So I do want to unpack the rising positivity rate and what exactly it's telling us. So we did not get that update that it was up to 6% now. So that essentially tells us that of all the population in Genesee who has gotten a test, 6% of them actually had COVID. We'll be sure to get that updated number and put it on that AFCHES website. So the number of actual cases is likely higher than the percent positive number, right? Because not every individual is likely to go ahead and get tested. But this measure is going to be so helpful for public health leaders to gauge how much of the disease is in Genesee County and to determine if further action is necessary to slow the spread. And it's also a really good factor for anyone as a community member to decide, to make decisions about going out or not. And I bring this up because as we look at the case data, we're in the 4th week of increases in Genesee County, and we are following state and national trends showing that disease is increasing. And I do want to point out that the last time we had crossed about this 60 case mark in Genesee County was about 7 weeks ago, and that was still when things were on the decline. So we can't express it enough to practice what we know. Wear your mask and be vigilant, and for the most effective protection, get a COVID vaccine. So let's kick off right with policy. So recent legislation is seeking to ban employers from requiring certain vaccinations as a condition of employment. And not only that, it would also prohibit employers from requiring unvaccinated employees to wear masks in the workplace despite the risk to others, especially those with weakened immune systems. So this is yet another example of unscientific health policy that will disproportionately impact certain populations. And again, there's another piece of legislation. For the details, make sure you're signed up for the brief, that would limit the powers of government entities, prohibiting them from incentivizing and even simply providing vaccine passports. Despite the fact, right, that we are seeing these rising cases and hospitalizations in unvaccinated populations. But on that note, I do like to end or balance the bad with the good. So I do want to take a moment and share some really exciting news that last night we did have legislation passed in the House that provides additional federal funding to so many great organizations in Flint and Genesee County. And it's going to support so many amazing initiatives, from a grocery store that you did see in the brief to mental health prevention and treatment services, combating blight, aiding homeowners with repair, and the list goes on to include Hurley Hospital and also the Genesee Intermediate School District. So I'm happy to end on a really positive note today, and also tell you President Biden did request Congress to extend the eviction moratorium, which we have talked about in this webinar. So just wanted to end on a happy note.
Thank you, Mary Catherine. And so everybody to go to read that brief so you can get all the details that are included in the policy brief. And again, if you have not signed up, please do so. So thank you, Mary Catherine. We want to go quickly now to the city of Flint. Lottie Ferguson is here with us today. So Lottie, we're glad you're here. Give us some updates. What's happening in the city?
First, I want to thank your panelists this morning, this afternoon rather. Just hearing from Sue and Moses and Jamie is always so much fun. And they point to the fact that Flint continues to face a number of issues, and COVID is another one that's just caused devastation in our city. Mayor Neely is incredibly concerned about the well-being of residents, and he wants to make sure that the city can offer services that support residents through all of these issues. And so last week, there were a couple of initiatives announced. One, the mayor declared a state of emergency due to the gun violence in the city. And so that included a number of executive orders, including the establishment of an emergency response team for traumatic events that'll help coordinate services between the Flint Police Department and mental health professionals. There are some partnerships being established to create opportunities for positive engagement with youth and community outreach programs and grassroots organizations. And there's even an executive order for crime suppression grants for small businesses. Now, a lot of these things that came out in executive orders were part of recommendations and input that the city received from the community on how to prioritize the spending for the American Rescue Plan Act dollars. And so we're appreciative of that, and we are continuing to ask for resident input on that. So you can go to the city's website to continue to put in how you believe the city should spend those funds. Additionally, as people are returning to work, the City of Flint's got partners with, again, United Way is an awesome partner on the workforce development program. They've got some success coaches provided through Michigan Works to work directly with employees. Now, this is specifically for Flint residents who are working with Flint employers. It'll help them to get the things that they need to overcome the barriers they need to return to work, including childcare issues. I know firsthand how hard it is to find good childcare, and it is certainly a shortage of that right now. So if you've got folks who need help getting back to work, help with removing employment barriers, they can contact the United Way at 810-762-0856 for more information. Thanks again for allowing the city to join you on a weekly basis. And if there's anything that we can do to help with any of the initiatives that have been mentioned, we are more than happy to do so.
Well, Lottie, thank you for joining us to be the voice for the programs and activities that are in the city and keeping us updated. As has been a theme throughout this webinar today and former webinars, the water crisis gave us a good platform for understanding the need for us to work together as a community. And we see that continuing. You also, the City of Flint, working with United Way, Greater Flint, Community Foundation of Greater Flint, and that partnership. Because what we realize is health is more than the absence of disease. We have to work on all of these other factors as well. And so thank you for giving us that update. And we're going to hear now from, I'm beginning to call him our resident doc, Dr. Reynolds. He's a retired pediatrician, but also has some great insights for us as a community. Doc, today, we've heard a little bit about the Delta variant, and we know that this is continuing to raise concerns for us in our community. There's some standard things that you've told us. I'd just like to give you a space this afternoon to give us, again, those really important insights from the doctor's perspective.
All right, and I appreciate this because this Delta variant is a different virus in its transmissibility. That means it can be spread more easily, more quickly, and the more cases you have, then the more issues you will have with emergency room visits, hospitalization, being on a ventilator, and maybe death. We don't know enough right now, but who wants to take the chance to be in the hospital when it could have been prevented? And I'll say prevention is the key component here. And when I say prevention, get vaccinated. No vaccine in you, not having been vaccinated and having immunity is zero effective. So please, compared to the vaccine. So please, don't hesitate to get vaccinated. And since it's so transmissible, and because there have been some breakthrough infections, it's important that we wear masks. And as we talked about in our last broadcast, it would be prudent to have a mask on when you are in the grocery store, in public places, in a classroom, in a church service, any inside social gathering. It would be appropriate. And it would be the right thing to do to protect our children and our loved ones who may be immunocompromised, who may have had an organ transplant. So this is key. And there have been projections, and this is from the CDC's latest document, which has not been officially approved, but given the higher transmissibility and current vaccine coverage, universal masking is essential to reduce transmission of the Delta variant. The other thing is watch your travel plans. I know it's summer and the weather's good and we'd like to see family. I just spoke to a friend who's going south to see a child who was a preemie. And not only do we have a problem with COVID-19 vaccine disease, we have a problem with respiratory syncytial virus. The numbers have increased, especially in the South and also across the nation. So we have to be very careful when we make visits that we are, number one, vaccinated, and it's been 2 weeks since our vaccine was given. Number two, under current circumstances, if you are inside, wear a mask. And number three, if you can do everything outside as possible. And lastly, if you have someone who you don't know their vaccine status is, don't take their word for it. Have them wear a mask, wash their hands, and keep the visits short if you can't do it outside.
Dr. Reynolds, if I can, you said something there, and we appreciate all the information you said, but you said respiratory, what was that?
Respiratory syncytial virus.
Oh,
It's a virus that infects children, and you get a cough, sometimes rapid breathing, but it can also cause your oxygen to get lower in an unsafe level. And if you have a preemie with a prematurely born infant with heart and lung disease, it can put them in harm's way. And sometimes it will require oxygen and hospital treatment. So these are the things that grandparents, aunts, and uncles have to be careful about.
So that's different from whooping cough.
Oh, yes. That's a whole nother issue. And that's why we should get us grandparents and seniors should get our whooping cough booster. It's called Tdap, and tetanus, diphtheria, pertussis booster. And you should talk with your physician about that. And you can talk to your pharmacist because they have it in stock also, and the health department.
So now, Dr. Reynolds, you talked about booster, and I know we had Dr. Wolford on last week, and I know she's on today talking about boosters. And both of you as pediatricians are really, I say, get excited when we talk about children's issues. And we do, when we talk about this overall health issue, even considering the COVID environment we're in, how important it is for children to get all of their immunizations. But you also mentioned adults. So I just want to take a minute, if we could, emphasize the importance of the childhood immunizations, especially as children are preparing for school.
Well, my colleague, Dr. Wolford, is the expert. I'll just turn it over to her, but get your influenza vaccine as soon as it's available in the month of August. That's for everybody. Okay? And then if I laid out the entire vaccine schedule, it may take a little time. So perhaps we should revisit that in our next broadcast.
Yeah. So Dr. Wolford, can you just share a little bit?
Yvonne, my audio went out a little bit. Can I share a little bit about the importance of getting the regular childhood vaccines?
Yes.
Absolutely. So just because we have COVID doesn't mean we don't have all the other things that children could be exposed to. And so as Dr. Reynolds said, we're seeing these outbreaks of RSV, and we don't want to see a huge outbreak of pertussis. And we don't want things that we have previously gotten under control, such as measles, etc., to come back. So we need for kids to get all of their vaccines, and for adults to get those so they can protect the children around them. And I want to add that in this whole sort of news cycle about the fact that there's the Delta and maybe the vaccine doesn't work as well, etc., it works better than not having a vaccine. If we were going out in the rain, we would use an umbrella. Even if our feet might get wet, it's better to have the umbrella than not. It is better to get the vaccine. than not. Even though it might not be as strong with all the other, with the new variants, etc., the vaccine is the best thing we can do, both the COVID vaccine and all the other ones that children need to get and adults to keep us safe.
Thank you, Dr. Wolford. And earlier, Moses mentioned our campaign that we've done for many, many years now, Be Wise, Immunize. And as we've had this conversation today, it made me think it's not just influenza, because that's where we started, talking about getting the influenza vaccination. So in many of the events that are going to be coming up later in the fall, there will be opportunity for both the COVID vaccine and other immunizations like the influenza vaccination. So we just want to encourage you. This is an opportunity for us to really put some thinking into it, talk to some folks that really understand, and let's get our questions answered. The biggest challenge we have is the lack of being comfortable with the information we have. So if we can get the good information that we need, get comfortable, let's make the decisions that will help us have an overall better outcomes of health and well-being in our community. We've had such a great webinar today, and I want to just again emphasize some of our participants have put in great appreciation for the information that was shared by our partners from the United Way and from the Community Foundation of Greater Flint. Sue, Moses, Jamie, thank you so much for being here with us today. Thank you, Dr. Reynolds. Thank you, Dr. Wolford. And of course, Lottie and Mary Catherine, we thank you for the information that you shared today. I'm gonna ask our participants and our listeners again, please be sure that you put information for us in the chat or in the Q&A. It helps us to be able to bring information to you that is credible from voices that you will respect. As we move forward, we're continuing to offer the community health workers continuing education units. We're going to ask you to please, when you go in, make sure that you click your area, whether you're a health worker or a social worker. Community health workers, this has been a partnership with the Michigan Community Health Worker Association. You can get those CEUs for attending the webinar. So we encourage you to do that. For contact hours for social workers, for Michigan State University, you've let us know that this is something that's been of value to you. As we reassess this, we'll be looking at the value that you've said in your surveys of this webinar for you. So we're going to ask you to continue to register for those continuing education units so we can be sure that we're providing them for you as needed. We want to encourage you to continue to like us on Facebook. We need to know that this is important to you. www.facebook.com. Go on that Facebook and like us there. Subscribe to our YouTube channel, Healthy Flint. Or you can email us with questions or for more information at info@hfrcc.org. And as I mentioned earlier, you can give us a call at 810-835-2130. Again, that number is 810-835-2130. If Dr. Deborah Verhoeven were on the call today, she would say to us those things that we need to do. She'd say for us to continue, as Dr. Reynolds would say, let's continue to mask up. We do understand that the state has relaxed some of the mandates, but it's your personal decision to mask up, to be careful that you are taking care of yourself in order to take care of others. Let's continue to wash our hands and be safe so that we can all be here together again next week. Please join us next week for our 73rd edition of the Flint Community Webinar on Coronavirus. We thank you for joining us today, and we'll look forward to you being here with us next week.